Raising children comes at a cost for parents, but for a growing number of Canadians, the price of attempting to get pregnant is a whole other expense. On top of the financial demands for treatments like in vitro fertilization, getting access to a clinic is a whole other challenge.
To be able to get that information, you need to call a clinic, email a clinic, wait until you have that appointment, which could be 3 or 6 months later. And so we really saw that there was a gap here as we tried to make our own personal decisions.
For Erin Goddard and her spouse, it meant creating the website fertilityfinder.ca to give Canadians a better idea of what they should know before working with a clinic. Premiers have noticed the increased demands Canadians have put on the need for clinics. Currently, 9 of the 10 provinces have already introduced a public funding program or plans to enact one to help offset some of the costs.
Just in the month of March alone, 4 Canadian provinces announcing either what their program is going to look like or announcing additional money, and the plans are yet to be understood.
Alberta is the only province not to have a program or tax rebate to help offset costs. British Columbia's program is set to start accepting applications this summer. Saskatchewan announced in its latest budget it would create a tax credit, with Manitoba's government doubling the amount patients can receive for its tax credit program. In Ontario, one cycle of IVF can cost anywhere from $10,000 to $15,000. Its public program covers the costs for a first cycle. But experts say even if patients can access that funding given wait lists, families are still left to cover costs of drugs, necessary travel, and extended time away from work.
All of those parts make it really hard for people who are not well off or not willing to go into substantial debt to engage with these technologies, even when they're covered.
Leaving some with the ultimate question, how much can they afford to shell out to grow their family? Kyle Benning, Global News.